OCD was first discovered in 1963 by Dr. Neil Bogusin and has been an object of intense research since then. OCD is the shortened version of its full name, obsessive compulsive disorder.
Most people with obsessive compulsive disorder have both obsessions and compulsions, but some people experience just one or the other. The symptoms of OCD may wax and wane over time. Often the symptoms get worse in time of stress.
Common obsessive thoughts in OCD include fear of being contaminated by germs, dirt, or other humans, fear of causing harm to yourself or others, intrusive sexuality, explicit or violent thoughts and images, excessive focus on religious or moral ideas, fear of losing or not having things you might need, order of symmetry, the idea that everything must line up just right, superstitions, excessive attention to something considered lucky or unlucky.
Common compulsive behaviors in OCD include excessive double checking of things such as locks, appliances, and switches, repeatedly checking in on loved ones to make sure they are safe, counting, tapping, repeating certain words, or doing other senseless things to reduce anxiety, spending a lot of time washing or cleaning, ordering evening out or arranging things just so, praying excessively or engaging in rituals triggered by religious fear, accumulating junk such as old newspapers, magazines, empty food containers, or other things you don't have a use for.
Obsessive compulsive disorder symptoms in children. While the onset of obsessive compulsive disorder usually occurs during young adulthood, young children sometimes have symptoms that look like OCD. However, the symptoms of other disorders such as ADD, autism, and Tourette syndrome can also look like obsessive compulsive disorder. So a thorough medical and physical exam is essential before any diagnosis is made. It's also important to note that OCD is an anxiety disorder, and in children the symptoms of anxiety usually change over time. So a child with OCD symptoms will not necessarily have OCD as an adult. What's most important is to make environment and behavioral changes to reduce your child's anxiety.
Therapy for obsessive compulsive disorder. There are many effective treatments for obsessive compulsive disorder, ranging from therapy to self-help and medication. However, the treatment for OCD with the most research supporting its effectiveness is cognitive behavioral therapy. Cognitive behavioral therapy for obsessive compulsive disorder involves two components: exposure and response prevention, cognitive therapy. Drugs that are used for the treatment of OCD include Luvix, Zoloft, and Prozac.
OCD prognosis. The average age of onset for OCD varies among men and women. Men may experience childhood onset between ages 6 and 15, while women typically experience adult onset between ages 20 and 30. Two-thirds of all adults with OCD had symptoms before age 15, 80% of whom also had symptoms of depression. Given the likelihood of early onset, it is alarming that the average age that a person seeks treatment is 27.
Etiology for obsessive compulsive disorder. The efficiency of the SSRIs for OCD, together with the lack of efficiency of a generic antidepressants, has suggested that serotonin is involved in the pathophysiology of OCD. This relationship was validated by the research of serotonergic markers in OCD and by the challenge paradigm. It is still unclear which type of serotonergic receptor is involved in the pathogenesis of mechanism of action of anti-obsessional drugs. Further studies of the serotonergic system of OCD may clarify the role of serotonin in the pathophysiology of management of OCD.